me feel like the leaves are gonna fall on me.
No chance.
Perley Health continually evaluates new technologies and implements those that can improve the well-being of residents. A current example is Magic Table, an interactive device designed to engage, entertain, and develop the skills of people with various cognitive and physical abilities.
I'm quite happy with it. It just tells me that there's an opportunity to expand my capabilities a little. I can have a game that I can play with, and I can actually do something with it.
Perley Health's Center of Excellence in Frailty-Informed Care continues to evaluate the impacts of Magic Table, and the early results have been overwhelmingly positive, particularly among residents living with cognitive impairments. Thanks to the support of donors, Perley residents now benefit from 4 Magic Tables.
We're doing a lot more projects that involve technology that are really innovative, like, for example, the Magic Table project that we're working on in collaboration with the Center for Aging and Brain Health Innovation. That's a really great example of something that we identified as an area for improvement in terms of social engagement for residents living with dementia.
Welcome, everyone, and thank you so much for joining us today.
Consultations with residents, family, and staff guide the Center of Excellence research agenda. This session, held at Perley Health in May 2024, included residents of other long-term care homes.
I think it's important for the residents to tell these young people how we want to be treated and how we want to live our lives.
Sometimes technology is the answer and sometimes it's not. So I think it's having that deep understanding of the problem and adapting the solution.
The Center of Excellence is also evaluating another technology being piloted at Perley Health. Developed by Esprit-ai, an Ottawa company, it combines motion sensors, transmitters, and software.
So our job is actually work with them to identify how can we use technology to provide early warning, early detection of something potentially bad for the resident or for the staff actually happen.
Esprit-ai technology may help safeguard residents who live with dementia and often get up in the middle of the night.
Part of the problem with dementia is that they can get quite agitated, and I know my wife does.
Fred and Joan Abe-Sandera, married 53 years ago, raised 2 children and now have 2 grandchildren. More than a decade ago, Joan was diagnosed with early-stage Alzheimer's disease. Fred cared for her at home until last year, when she moved into a secure unit at Perley Health.
I was very pleased to participate in this because I thought this is a good step, I'm sure I could see benefits to the program. I think it leads to better care in the end.
When we actually start to work with Perley, we start to say, oh, what about this? What about that? So we can use that in some ways as a little bit of learning experience as well for us to actually keep enhancing technology so that we actually teach the technology to adapt to the human needs.
The Center of Excellence recently completed tests of a third technology known as Re-Guard. Developed in partnership with the University Health Network and York University, the technology uses a specialized virtual reality program to improve and maintain visual perception and attention.
So this project is like a gym for the eye. The way you work out every day to keep your body fit, this is basically a game which you can play every other day, and you're training yourself to see how quickly objects move, to identify objects, to point at them and click at them.
We're developing a reputation for being a good partner, for being able to take these projects on here on site.
I love Perley Health and I'm so grateful I work here. I think it's an oasis in Ottawa for me. It's one of those few places which just doesn't talk about technology but actually does what it can.
So it's really developing that culture of innovation and research right here in a long-term care home, which is really exciting.